Hello everybody. Greetings from the founder and editor-in-chief of the International Journal of Neonatal Screening. We're celebrating this year 10 years of our journal, which made an extreme success during these 10 years. At the beginning there was an idea that neonatal screening and the International Society of Neonatal Screening would need an own journal after two trials with two different journals. Now we gained a huge success with a journal that gained an impact factor of 4 during these first years. But mainly I have to thank all those authors that sent their high quality manuscripts to our journal during the first years when they were not searchable, when they were not citable, well, citable yes, but not searchable in MedLab, and had not yet any impact factor. But due to these authors during the first years, we could make a rapid success, and I'm sure that we'll proceed with this success in the next 10 years. Thank you for all of your support.
Hello everybody. It has been an absolute privilege to be connected to International Journal of Neonatal Screening, first as an associate editor and since 2019 as editor-in-chief, together with founding editor-in-chief Rolf Fingerhoed. Before 2015, the ISNS was a global society with 25 years of history, but no professional journal. In 2015, through the work of Ralph, we were able to start the International Journal of Neonatal Screening under the wings of MDPI publishers. And there was no guarantee for success. Attempts in the past had failed, although the journal Screening existed for a few years. So it was an uncertain journey through uncharted waters. And to continue the analogy, we built a ship, and through the years we got more wind and set more sail. This could not have been done without the help of the managing editors of MDPI. We started with Rui Louis and her team, and Rui Louis was wonderful. And for the last 5 years now, we work with Jin Ding and his team. Through Jin's guidance and enthusiasm, we managed to arrive at the point where we are now. A highly recognized journal with an impact factor of 4, with 2 chief editors, 4 associate editors, an editorial board, and a dedicated group of reviewers that we can rely on to guard the high scientific standards of our journal. To give you an insight in the inner workings of International Journal of Neonatal Screening and its editorial board, the editors-in-chief and associate editors meet regularly to discuss themes for special issues, further policy issues, and other items of the journal. On a weekly basis, we discuss manuscripts that need extra attention because of quality issues, or scope issues, or conflicting reviews. Meanwhile, our reviewers put in their hard work and voluntary work, their hours and their experience and competence to produce high-level reviews. That is so much work, but in the end it's extremely rewarding. And I guess that this is just to say that the success of IJNS should be owned by all of you. Authors, reviewers, editors, associate editors, the managing editor and the team at MDPI. And 10 years of IJNS is something that we will celebrate at the 13th ISNS Regional European Meeting, March 23 to 26, 2025, this year in Luxembourg. Now, let's build on this success and set sail to the next mark on the horizon, 20 years of International Journal of Neonatal Screening. Congratulations to you all.
Hello everyone, my name is Jim Bonham and I've got the great privilege on behalf of the International Society for Neonatal Screening to pay tribute to the important work of the International Journal of Newborn Screening over the last 10 years. It's an exciting time to be working in the field of newborn screening, and newborn screening itself has much to celebrate. It's just over 60 years since Bob Guthrie gave us a test for one condition, PKU, and introduced that into the United States. And since then, things have grown immensely. We've tested for more than 750 million children worldwide, and each year, almost 500,000 children benefit from the life-changing intervention that newborn screening can offer. We now test around 40 million babies a year right around the world. And although that's quite an achievement, there are still 100 million babies each year born who are not offered that important intervention shortly after birth. Recently, we marked a really important milestone. In 2024, the World Health Assembly, they approved a resolution indicating the importance of newborn screening in its widest sense in all healthcare settings. And we believe that will make a huge difference as we try and extend newborn screening around the world. And it's not just the number of babies that we test, but it's also the number of conditions. Genomics has made great strides recently in offering treatments and also in offering means to test children. And there are 20 active projects looking at genomics first as part of newborn screening. There is one thing that is central to all of these opportunities, and that is evidence, and particularly peer-reviewed published evidence. Doctors, scientists, and health policymakers have got to make difficult, balanced decisions as they seek to do newborn screening well. And of course, that's where IJNS comes in. It's the leading journal in the field and has a hugely important and crucial role to fulfill now and in the coming years. Congratulations to the publishers, to the editorial board, and of course to you and many other scientists and doctors who submit publications to that journal. We look forward to the coming years and growth on a grander scale than in the last 10 years. My thanks to the whole team on behalf of ISNS. Thank you.